All right, everybody, welcome to Clear Vision Wednesday. Everybody on YouTube, I'm super excited for another episode of the Clear Vision Wednesday show, whatever we want to call it. I'm Claudia Mühlenweg. I'm a natural vision improvement teacher and the creator of the Natural Clear Vision Method. And I've been doing this for like 13 years, almost 13 years now, helping hundreds and thousands of students or clients improve their eyesight naturally. And please subscribe to this channel, like this video, subscribe to this channel. Every week we're going live here, and many weeks I have great guests. And we're going to talk about all the different aspects that affect your eyesight and your vision. And before you might not even know the difference. Eyesight is visual acuity, like 20/20, right? What you can see on an eye chart. Vision is all these other aspects, right? It's our peripheral vision, our night vision, our color vision, our binocular vision, our vision for our life. So vision is like that bigger word. And eyesight is more the actual acuity of our eyes. And today, I'm super excited to have my friend and colleague, and let me bring her on stage, Deidre Nazareth on. Welcome.
Hi, Claudia. So nice to see you. And thank you so much for having me be part of your wonderful forum of amazing information on how to improve your eyesight. I think it's wonderful, especially being someone who suffers from bad eyesight.
So, well, we did an Instagram live before, so we haven't even said what you're doing. So you are an osteopath, functional medicine expert, and you also have a master's degree in pain neuroscience. And before we get into your story and how you help clients, and can you explain briefly, because I'm from Europe, I'm from Germany, right? I loved osteopathic treatments. They were so gentle and so effective. And when I moved to the US, I realized it's very different here in the United States. So can you quickly explain just, the roots of osteopathy and how it's different in Europe versus the United States so people understand what we're talking about?
Yeah, sure. So a UK or European trained osteopath wouldn't be called a doctor, first of all. It's just that title is really resigned to someone who's a general practitioner here. And that's even the case with a veterinarian. So my brother, who did his veterinarian degree, he's not called a doctor either. So,
interesting.
Yeah, I know. I'm not sure exactly why they do that, but they're quite strict about it. But in the US, osteopaths have a medical degree, meaning that they prescribe and they do residencies just like an allopathic doctor would. And most of them have lost the manual therapy aspect of the degree. It was actually started in the US by Andrew Taylor Still. And the reason why he started osteopathy was to divert away from using pharmaceuticals as well as surgeries as the mainstay of treatment. He really thought that the body had the inherent capacity to heal itself, and he used structural techniques in order to make that realized. So that's where the difference is really. But in the US, it seems to have gone back to allopathic. However, there are some osteopaths who I train with regularly, actually specifically for the traumatic brain injury classes that I do. And they are primarily cranial work. So that would be cranial sacral osteopathy, which is using very gentle techniques, probably something along the lines what you would have experienced. We are always thought about here as treating backs. That's a common thing, or a common thing that people say is like, oh, my back, or you fix backs, right? Well, we fix other things too. And we look at the body as a whole unit of many different systems. And that's essentially what it is in a nutshell. So when you go to see an osteopath, you're not going to get exactly the same treatment every time. And that's really going to depend on the different ways people have, what they've studied, where their preferential treatments lie. Some people do some manipulative therapy, which is the cracking or the more chiropractic style of treatment. And there are some who just do more soft tissue mobilizations, and some who don't actually do any hands-on. Some people do talk therapies, which is more related now to handling some of the more chronic pain conditions and understanding the pain neuroscience and why that would work versus, there are actually osteopaths in France who do distance treatment, over the
Wow,
phone.
that's so interesting. I mean, that I had, where basically, like you said, yeah, sometimes she would just hold my scalp for like 15 minutes, so gentle. And I did have back problems. I did have lower back problems. I took my children to they had a clinic, for people that were in training, and then the master teachers were supervising, and they would always have you stand first and look at your posture and look at how everything looks like, right, from a balance and integration standpoint. It was so fascinating to me. So yeah, so it's very, I like what you said. I didn't realize that even within like the European system that there's so many differences, that some people would even do cracking, because I always found it was such a gentle, and I have a chiropractor that I love too, but I always thought it was such a gentle, super effective treatment. So that we want to say that at the very beginning, so that osteopathy is, I didn't even realize that the width of how, osteopath in Europe or osteopathic doctors in the US, how differently they treat things, right? So we are focusing today more on the manual approach, and that's why we call it the healing hands of osteopathy. So we are focusing more on the treatment where you actually get what we would call body work done versus, talk therapy or, prescriptions or something like that, right? I just want to make that clear. Okay, great. So tell us a little bit about your own story, about your own how you got into this, and also your own story with your vision and your eyesight and what happened.
Yeah, so I always wanted to be in medicine, and I basically spent pretty much all of my life doing work within that field, whether it was working in the hospital as a candy striper and volunteering. And then later on, I went to be an EMT while I was in university. And all of those experiences of being in hospital really showed me that actually I don't want to be prescribing drugs necessarily. I think there's a more holistic way of treating things. And I was always drawn to that, maybe because of my ethnicity. My culture is Indian culture. So I was always drawn to Ayurvedic principles as well. So with my own experience, it's actually something that happened when I was really young in terms of my eyesight. I told you briefly about this, but I had suffered a concussion, which I didn't actually realize at the time. I knew that I had hit my head really hard. I have this scar here. And I was about 4 years old. I was sitting on a railing and playing around, and I slipped and my foot fell off the bottom rung, and I just swung down like a pendulum really hard. And I was still holding on to the top of the railing. So it really hit my head hard. And of course, my head was cut open. My forehead was, bleeding. And I don't think my parents even really understood how bad my head hurt or how bad that was at the time. So, we just did the usual, put a Band-Aid on it and just kind of left it. Oh, she's fine. She's, I kind of saw stars for a bit, but then I was so young, I don't remember exactly the next steps after that, but I know that I didn't go to the hospital. I know I didn't get to the emergency room or anything. I was fine enough to be able to go home, go to bed, and get up the next day. So a year later, I basically lost my eyesight. Well, again, I didn't know that the two were correlated. In my right eye, I couldn't see past the big E on the chart. And it wasn't something that I noticed right away. It was something that I just noticed when I started, I think my mom said that I was walking around with one of my eyes constantly closed like this, because I could see better by cutting out that eye. So I guess I was also reinforcing the fact that I was making this eye weaker. And it didn't really deter me that much, because I was still playing sports and I was still doing things. I was quite an active kid. I just kind of got on with things, because at the time, we also didn't know that these things were so significant and they could actually make an impact in so many areas of your, of your nervous system, how you learn, all of these things, even your coordination and balance. I didn't actually draw the links between the two. So it wasn't until I started really focusing more on treating traumatic brain injury and after doing the functional medicine certification, that I said, oh my God, I think I've had a post-concussion syndrome. And I kind of went back through my history and thought, oh, wow, I remember having these moments of almost like dyslexia and dyspraxia and feeling so frustrated that my body couldn't do the thing, even though I knew that I wanted to do it. And sometimes having a discord between what I was seeing and what I was doing. And I never put it down to the injury ever. And it also, after that injury, I became more vulnerable to changes in body temperature. Like I had really bad effects with dehydration. I couldn't stand really loud sounds and really bright lights. So, but again, never knew that they were maybe connected. And I actually had continued to play sports. I was playing soccer all the time. I was, playing lacrosse, soccer, horse riding. I was doing lots of different things and constantly having like some kind of jarring motion, which was affecting my brain as well. I didn't know that was potentially a problem too. So I got hit in the face with a ball several times, with the lacrosse ball as well as with a soccer ball.
Oh, those are hard.
I've sustained quite a lot of head injuries since, and also have fainted as a result on many occasions from dehydration and lost consciousness. Anyway, long story short, I've had a lot of head injuries. I think it's the combination of the treatments that I do to myself, as well as when I go to get treatments, the things that I eat and the activities that I do that have maintained my ability to at least stay functioning. So yeah, I think that has now really forged where I want to focus my attention with clients, is like understanding the effects of chronic pain as well, because that's what I treat. As an osteopath, you would go to be treated for pain. And when I was doing my osteopathic degree, there was the master's in pain neuroscience at King's College, which I thought, okay, I feel like I need to understand the neuroscience a bit better. And so I applied to see if I could get in. And if I got in, I would have stayed in the UK, and I got in, so I stayed. And then that has basically led me to what I do now. So it's an understanding of the neuroscience of pain, how you can educate people on pain, and how that can have an impact on their understanding of what's going on in their bodies, things that I've suffered myself, which I didn't make connections with, as well as like other things in terms of diet, lifestyle, and how to improve those things.
Well, that sounds, yeah. And I think you even told me you had to wear a patch and all those things. So your vision is stable now, functioning. And I think you're right. I still is a little bit amblyopic. We can always talk about that, but you definitely your vision. And do you have any stories about people that you worked with? I know you're focusing on pain and traumatic brain injury, but did you have any examples of people that improved their vision through the treatments that you could share? I would be interested.
Definitely. So I treat children as well as adults, and quite often if we unravel trauma a bit, because trauma is not just physical, it's also emotional. And back to just to touch my story a bit more too, when I had that head injury and I had lost my eyesight and I had to wear that patch. Thank you for reminding me, because I obviously had blocked that out because it was such a bad memory, but I was made fun of incessantly by the kids at school. And that was an emotional trauma for me that I attached to wearing that patch. So if I had kept wearing it, and if I may have had better eyesight. I don't know. It's not something I would know now, because I just basically would go to the bus stop, take it off and put it in my bag, and then just got used to using one eye as my dominant eye. And I would put it back on when I came home. And then I was watching TV, basically looking like I was wearing a bifocal lens on my right eye, and I couldn't see anything. It was so blurry. So with kids, especially when it comes to understanding pain and what they're going through in terms of their potential visual problems, there's a lot of emotional stuff attached to that. And so I always go through the explanation of what could be contributing to that issue, and then as well as for adults. So when we work on the body, one of the ways to get into the body and I'll go through this when I go further into my talk, but your body gets into a state of suppression. It does that in order to help you navigate through a traumatic experience. And that suppression can be emotional stagnation. It sticks in the body somewhere. So this is also known as a freeze response, or, as some of my teachers, the osteopaths that I train with in the US, Dr. Maud Nerman would say this is called injury shock. So injury shock is kind of like a permanence. It's an impression that's left there once even past the injury has healed or the trauma is over. The body remembers, and I'm sure you've probably heard now, there's so much more information about trauma healing and trauma understanding and how it impacts the body and how it impacts our ability to really have our senses working optimally. So books like The Body Keeps the Score and other trauma books, these are becoming more apparent now, because when you have had a trauma, especially in childhood, it impacts how your brain is functioning later on in life. And
So
if there's,
sorry to interject, but when you work
yeah,
with the adult or a child, you can basically, the body kind of tells you what to do, right? The body will guide you, because especially as children or even as adults, we can often not express it, so suppressed, our unconscious trauma, that we don't know, right? It's not here on the top of the mind. So you can kind of work with that, with the body, to kind of release that. Is that what I'm understanding?
yeah, exactly. So the body, when you touch someone's tissues, they may not have any idea or understanding that that tissue is a diseased or ill feeling tissue. I will, someone who is trained to be able to treat manually will be able to sense that and will be able to feel it, because in terms of how the body contracts and expands, and even how the brain contracts and expands, we have a rhythm. Everything in our body is a rhythm that you can feel, because we are mostly fluid. So if we don't, certain tissues that have been injured, or they're, chronic, when a tissue is chronically injured, it feels different than something that's been an acute injury. So why I think that, like with anything that's chronic, you can get to a certain level with treating through diet and supplementation, but I really feel to push the needle past, you really need to teach the person, how does that feel? What does that feel like? What memory is that bringing up for you? What emotional what emotions are you feeling when I press here? And that was really one of the things that, I'll tell you about my experience with body work on my in one of the courses I did with manual therapy, how I was able to see after I had the person who I trained with is called Douglas Heel, and he did this activation, Be Activated course, which in all sense of purposes, it's manual therapy. But in this specific course, we were testing visual field, and in a way of using kinesiology to assess, when we look certain ways, is our body shutting down? So that is ultimately when you have a state of sympathetic dominance, and that's trapped in the body, you may not be able to have the same strength as you would if you didn't have that. And but you wouldn't know that, because you've just gone through life with this way of doing things. It's almost like a cheat pattern. You can see that in the streets when you watch people walk. Everyone has a different way of walking. Everyone has a different way of holding themselves. And that's really down to what's going on in their brain. They can be completely numb emotionally. So we actually can be completely numb from the neck down, because we have no awareness and body awareness, because we're stuck in a state of sympathetic dominance. And that could also be because of past trauma, but that could also be because of present. The way that the brain works is it's constantly ruminating from the past to the future in a way to protect you. So it's always analyzing things. And if you're if you're starting at a base point of already having trauma, physical or emotional, then you're going to be in a more hypervigilant state from the get-go. Does that make sense?
Can you explain? Yes, I'm really fascinated by how can you explain that again about the visual field? So can you just show, like, I know maybe it's hard to show on yourself, but how does that work technically?
So what you can do if you want to test your visual field, you can take your hands, take your thumbs. I would just like do it from the side. So you can take your thumbs, put your thumbs in front of your face, and without turning your head, just see how far you can get your hands and still see your thumbs in your peripheral vision.
So you're
looking straight ahead at your thumbs, keeping your head straight. Move your thumbs, and without turning your head,
right,
how far you can get your thumbs out to your peripheral vision. And this will change. And if this is how far you can get, then that's how far you can get.
Right.
And that's our baseline. And then what I would get people to do is do a parasympathetic activity, which is first and foremost working on your breath. So working on areas of the diaphragm to release the diaphragm themselves, or if they're seeing me, then I would do it myself. I always start with the diaphragm, and I always start with releasing that, because when you're in a state of sympathetic dominance, which is everyone who has chronic pain, so anyone who has pain that has outlast the length of the tissue for it to heal. If you're getting recurrent pain, or if you're getting recurrent injuries, these are all examples of chronic pain. This is not something that is because there is constant damage. It's actually because the brain is sensing a threat. So when the brain is sensing a threat, it will produce a signal, which is the pain signal. And then it will affect all of your senses, because how do we perceive threat? We perceive threat through all of our senses. Our senses are sight, primarily, sense of smell, touch, taste, and then we also have proprioceptive sense. So how we know where our body position is in space and how we move is also going
hearing,
to.
right? Hearing.
Oh yeah, and hearing. I forgot hearing.
Fascinating. I noticed that that for some reason I don't see my right as far as I see my left. But I mean, like literally just like an inch. It was tiny difference. So when you do that, and do you do it up and down diagonally too, or are you just doing? Okay.
I do it all over. So
you're touching the body, and so like I really want to understand this part. So that's fascinating. I've never heard of that. So when they do that, and let's say you notice it, as an example, this is not the case for me, but let's say I don't see my, thumb here anymore, but the left is, but like, what would you do next? What would be
I test. So then I say, okay, there's their baseline. Then I say, okay, look in that direction, keep their gaze in that point. And I'm going to work on their diaphragm, and I'm going to work on their body in a systematic way, and see where the body is shut down by feeling the tissue, what's painful, what's non-painful, because your body shouldn't necessarily emit pain. If there's pain there, it's because there is that situation of injury shock, or we call it trapped central sensitization. There's something there that the brain has like, oh, I put that away for the moment and I'm going to come back to it later, but it's producing a painful sensation because your brain is like, what do I need to do? What memory is this attached to? And typically when I work on the body, people will say, I just had this memory of when I did this when I was a kid, and I haven't thought about that for ages. Or I've even had people completely break down in tears before I even got to the rest of the diaphragm, because their body has been so good at suppressing that emotion and keeping it there, that when you release it, it just comes out and they don't know. Because when we talk about pain of any kind, and there's even acute pain, there's always an emotional component that goes with it. you can't extricate the two. And understanding that, because when we think about how we interact with our environments, we are psychological, emotional, and physical spiritual beings. So we're constantly getting all of these inputs all of the time. And if you have pre-existing trauma, then that trauma is going and it's not resolved. Your brain is constantly doing things to help you remember so that it protects you. And when you have a constant input and you have a chronic situation, what happens is the brain actually gets smudged. You know, we have our whole body is represented on the cortex of our brain. And that's when you touch your hand, you know that, oh, I'm touching my hand here on my right side. It goes, you know, the signal goes up through the spinal column up to the brain down. Oh, that's soft touch. Now, if I had injured myself, or if I changed the pressure that I'm putting onto that point, and it's starting to now be a little bit more physically painful to the person, like discomfort, that's starting to bring an alarm system. It's starting to activate the sympathetic system. It's starting to activate, oh, do I need to be worried about this? Her pressure is getting harder. And so now that sensation is traveling faster, and your brain's like, okay, have I been here before? Have I had this experience before? Is she going to hurt me? Because you're always trying to compare to what you've had in the past to what you potentially could be in the future. So that is what happens when you have had a painful incident in the past. Your neurons will be more sensitive to transmitting that information, and it will do so to the point where it will reorganize that cortex. So if this was the injured part, if this was the injured limb, then this representation is going to be much bigger on my cortex than any other part. So anything that comes within that vicinity will actually trigger a pain signal in there.
Wow, that is fascinating. So I want to close the loop though with the vision. So basically the visual system gives you a clue, you know, even if it might not be related to visual problems, right? It gives you a clue, the visual field as to what happens with the brain, right? So there's a connection to that. And then working on the body, we had a optometrist on who does syntonic color therapy, and she can see the same thing, how the visual field is really shrunken with traumatic brain injury. Right? And so that they use colors. It's a different way of it, you know, changing that. But basically, when you do those body or physical treatments or, you know, body touch, then is that periphery, assuming they don't have glaucoma or any other kind of, you know, pathology in the eyes, is that then actually restoring that peripheral field after that? Is that the case? Or
yeah, and you can do this test on yourself. So when you get your system into a state of more relaxation, when you work on your diaphragm and when you do your diaphragmatic breathing and you get your state more parasympathetically balanced, your visual field will increase. And you can test that. And you can actually, you can see throughout the day how it changes, because it's not going to be an on or off situation. It's going to be a dynamic thing that's impacted by everything that you do in the day. So, you know, how many thoughts do we have in the day from the moment we get up to the time we go to bed? Most of those thoughts are stressful or negative. So that is going to impact. So let's talk about what the sympathetic nervous system is. If you're having negative thoughts, that's a sympathetic thought. That's going to have a biochemical event in your body, which is going to be a stress increase. So you have got an increase of stress hormones and glucocorticoids, which are your adrenaline and cortisol. And that's not even from a physical thing. That's just from a thought. So your brain doesn't know the difference between a thought and a physical reality or something that happened in the past. It's relaying information. It brings things. And that's where perception comes in. And that's where vision, because as you said, vision is brain-based. Vision is, you know, eyesight is acuity. We see with our brains. So if your brain is not functioning, then you're not seeing very well, or you're seeing distorted, or we have illusions all the time. And this is coming back to the chronic pain science. The pain is called an illusion. My teachers have said that, Dr. Lorimer Mosley, Dr. McThacker, these are all people that I learned from. And it's to say that our perception of what's going on in our body is thwarted by previous experience, by a stressful or a stuck sympathetic system. And you can be going along happily. It's not to say that you can't exist doing that, but you don't exist well. You don't exist optimally. We can get by with not seeing very well, or with not hearing very well, or just, you just go, oh yeah, I've had that for so long, it's fine. But what people, when they come to see me for manual therapy, one of the first things that they say, I have a few patients, they've said, oh my God, I can see such bright colors now. I never knew I could see such bright colors. The colors are so vivid. Or another sense. So we're talking about vision, because vision is when your brain actually utilizes anywhere from 50% to 2/3 of its energy to visually process information. That's a huge amount. And when your eyes are open, that means that majority of your brain power is going to visual processing. So if you're in a state of sympathetic dominance, then that means that your visual processing is not going to be very clear. It's going to be tunnel vision, right? So it's like the horse that is in the street with those things on their eyes. They can only see what's in front of them because they can't, maybe opening that is too much. But when you keep working on the body and you keep coming back to this ability to go deeper into a parasympathetic state, you're allowing your visual field to go, okay, I can see. Oh my God, I can see. So for me, when I had that experience of having Doug actually worked on my diaphragm, and we did this whole test with the visual field, and we were, doing the kinesiology, testing the arm, whether it would drop. And my arm, when I tested my right eye, was actually really strong. So I was surprised. I was like, oh, that's so funny. I thought my arm would drop when I tested on the right side. It dropped on the left. And I kind of went into the story of saying, oh, when I was a kid, I had to wear a patch and blah, 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 blah. And then he ran and got this cover for the plinth has these like cloth covers, and he put the cloth cover over my head, and I was instantly, and then he was working on my diaphragm, and I was instantly brought back to that situation of being a kid and being made fun of with the patch on my eye. And I was in floods of tears, and I completely just didn't even, it felt like my body transported in time. I don't know, it sounds really magical, but it really did, because I didn't even think of myself as being the adult. I thought of myself as being the 5-year-old with all the kids pointing at me and making fun of me. And then when he took the thing off, I suddenly realized, oh my God, these are not kids at school. These are my colleagues learning with me. And I suddenly could feel my eye working in a way that it never had before. So that, we can say that, yes, of course, there was a physical trauma there, but the emotional one was sparked or released in that moment. And I could feel my muscle was actually working. Like I could actually see, not clearly, but I could see better than I had before. So if
that is amazing. And sorry, I didn't want to, but I 100% agree with, and that's a lot of that I teach too with my own methodology, right? So everybody, just so in case you don't know, sympathetic arousal or dominance means you're in that stress, fight or flight mode, oversimplified, right? And a lot of us are, and I was exactly that. My diaphragm was frozen, my jaw was frozen. I didn't have any sensation in my body before I got into this work as well. I'm curious. Now, we didn't talk about this ahead of time, but as a story, and I'm going to have another vision teacher come on in a few weeks, where, strabismus is one of those things, right? When you have a squint, when one eye goes in and out, where the traditional approach is to cut the muscles, one of the outer 6 extraocular muscles, usually gets, let's say the eye goes in, then they cut the medial and the lateral muscle, and then they kind of lengthen that one and they tighten that one so that the eye looks straight. Now, that doesn't actually mean that the eyes work together as a team or any of that. And I heard a story, this wasn't somebody I worked with, but I heard a story. So somebody fell off a ladder, right? You hit the head, they fell off a ladder, fell to the left and looked down as they were falling. And the left eye got stuck in that kind of outer position, right? The kind of wall eye, it was kind of stuck in that traumatic response. And with healing, and I don't know, I remember the exact modality they used, but it went back to normal, but it was literally frozen in that muscular, like traumatic response. So have you had any, I don't know if you did, but like that to me is so fascinating. That is just, and then the surgery wouldn't have actually addressed the root cause at all.
No, exactly. And this is where understanding the neuroscience behind injuries and trauma and pain and all of this can really help you make a difference in your decision to get a surgery or take a really strong painkiller that may not work, and this is what we're seeing with like opioids, not to get off on the tangent there, but like, yeah, I have had kids who have said they could see better, they felt better, they could read better, they could focus more, they were focused attention. So all of these aspects of vision are really important, like down to your vestibular sense. You have your vestibular system is what helps you see as well as hear. So your head position is really important for that, because you have reflexes. You have 3 reflexes that kind of govern your head position as well as your posture. So, with sympathetic dominance, we talked about that, if your brain is perceiving threat, that means that you're initially, think of all the things, if you're going to fight someone or you're going to flee someone, the posture is the same. Your shoulders will come up, you're going to collapse in here, your protective posture, because you're going to fight or flee, you're still protecting. So you're going to be scrunching your diaphragm. You're not going to be doing these really, nice recovery breaths. You're going to be shallow breathing. You're going to be clenching your jaw, which we know actually has an impact on your ability to breathe as well. So you're just like this. And then what about the eyes? So you're going to be like dilated. You're assigned to be, when you're in parasympathetic, your eyes constrict and they allow that blood flow and that lymphatic flow, because your eyes actually don't have their own lymphatic channels, but the constriction actually helps your fluid within the eye, right? It actually helps that. And along with the closing of the eyelids, you pump there, but also think about like where your head posture is going to be. If you're sympathetic, your head is going to be down because you're protecting, and your neck is going to be scrunched. But, you have to be able to see ahead, because if your head is down, you can only see what's in front of you. So you're going to be like this.
And how many people know
are like this?
Yeah.
So it may not be that it's the posture that's the issue, because your posture is dynamic. You're not going to make a huge difference by wearing a lot of these contraptions and things. It's more about getting up, standing up, and getting your blood flow moving. Your movement, your body needs movement. So you need to be out of this flexed posture and into more of an expanded posture. And once the brain senses that expanded posture, then it goes, oh, I'm not stressed. You can actually change how you feel in your body just by working on your posture in terms of breathing. When you breathe diaphragmatically, your posture will naturally open. If you keep breathing short and shallow, all these neck muscles and everything get really tight, and that's going to impact the fluid and the ability, all the fluid flow from up and down from your eyes. If you wake up and you have puffiness around your eyes, that's a sign that you have poor lymphatic drainage. And manual therapy, we are, one of my teachers said, we are the mechanics of fluid or lymph, because we work on the body to affect not only the fluid flow of the blood, but the lymphatics. We help. Your lymphatics are your doctor and your janitor at the same time. They bring the emergency medicine that you need, all the nutrients and everything to recover healthy tissues, to help your eyes to clear, to bring tears if you need them. All that fluid is pumped by your ability to breathe, by your ability to move. Your ankles are the things that push your venous blood and your lymphatic back up so that it can drain. So if you're in a state of sympathetic dominance, it's going to impact not only your stress hormones, but think about where is your blood going to shunt to? It's going to shunt away from your head and into your arms and limbs because it thinks you're fleeing or you're fighting. So that's where it's going to go. And it's going to go away from your digestive system and away from anything that is not seen as a priority. So sleep is affected, your circadian rhythm, which is largely dictated by your hippocampus, which is the part of your brain that does memory, long-term memory. Why is this important? Because pain and the underpinnings, the neurophysiological underpinnings of pain is how we learn. We learn and we remember. We have to remember pain because we need to be able to protect ourselves. This is all done by hippocampus. Your hippocampus is your long-term memory. And then you have parts of the brain that deal with fear and emotional regulation. And this is your limbic system. And then your personality and all of these things that contribute to your perception of life in general. So these are all the parts of the brain that also process pain. So if you have chronic pain, that means that you have an oversensitization of these areas. And that's why having one treatment is not necessarily going to be the thing that works, like i.e. a surgery or a drug. It may be a combination of things, and it actually is. We know that, when it comes to dealing with things like these vision problems, now more than ever, I see that actually, and even seeing some of the things that you've been doing, we know that, actually, is this just, like you said, is it just a Band-Aid? Is it just a crutch? Are we actually getting to the root cause of the problem? And more often than not, we're not. So, holistic stuff is becoming more apparent because there is much more scope to really harness the things that we have naturally with us, within our bodies. Our bodies are designed really well to heal themselves when they're given the right tools to do it, or the right space or the right environment. All of those things are really important when it comes to osteopathy as well. Like, it's not just manual therapy. We are looking at, as I said, the body. One of the principles of osteopathy is the body is a unit of emotions, spiritual and physical. So if your environment is conducive to more sympathetic dominance, that's not going to help. You need to have all of that take place in your analysis and your treatment. So yes, I do believe, though, that the manual therapy is one of the best ways to really sense what's going on in your body. Otherwise, you're kind of blissfully unaware.
Well, first of all, this was really amazing. And I love what you said, that there's this multi-pronged approach. A lot of what you shared, I work with the body, with the, teaching the little myofascial release sessions that I do. And it's such a great overlap. And I think sometimes, something might not work for somebody, so you need to do something else first, so it's kind of like we're all unique in a way. And I love that you said maybe one session is also not enough. But even with osteopathy, you can have amazing results in one session, and sometimes it takes a little longer. And doing all the different angles, right? A lot of times people want to hear from my experience, I exercises, right? And then maybe they come to you and think like, oh, the manual treatment is all I need. Yes, it's super important. However, it's also their own awareness and how they then daily, like, recognize those triggers of stress and all those things. So that was fascinating. I know you had some slides. I don't even know if we need them, or
Yeah, I
do you
don't
feel
think
that
we need them. I just talked.
Yeah, I agree.
They're
I
only
agree.
for visual purposes, but actually in terms of visual purposes, and this is a tool that was given to me by another teacher on a course I recently did named Hillary. And I thought it was a fantastic tool just to be able to understand what happens with when you're in sympathetic dominance. So have you seen these finger traps?
No, can you point them a little closer to the camera?
So it's like it's a little, I don't know, you get them, they're super cheap. You get them in like fun fairs and stuff. I mean, we had
Oh,
them.
yeah. It looks like some kind of 99-cent stores who else.
Yeah. It's a finger trap. And when you put it in and you pull, you can't get your fingers out. So this is a way to understand when you're sympathetically dominant, everything is tight. So think about all your vessels. They're like tight like this. Tight. So your capillaries, it's going to shunt blood flow away from all the places that you need. So blood flow is going to contain water, right? So everything is tight. If you want to restore fluid flow, you have to relax. And that's the way to get your finger out. You just... So remember, pulled tight, sympathetic dominance, relaxed is parasympathetic. And that's a visual to be able to understand, okay, why are my eyes like so dry? Why are they blurry? Why are they potentially seeing double? It may not be a problem inherent in the actual eye, but it may be the fact that you are not getting any of the things that you need because you're in a state of like staring, or you're thinking, you're ruminating about something in the past. Maybe your brain is subconsciously doing that, because when you have chronic issues, that's what happens. The rumination and the catastrophization and the worry about the future and the things of what your pain presentation means to you, how it's going to impact you in the future. These are all things that we don't have conscious awareness of these thoughts all the time. They just happen. But it's having an impact on your body, because every thought is contributing to that sympathetic. And then suddenly you get to the point where you're so fatigued because your whole nervous system is fatigued. And that's pretty much what happens with chronic fatigue, chronic pain, fibromyalgia. All of these things that are chronic pain syndromes all have similarities, as well as manifestations in parts of the body that are very similar. One of them is...
I don't want to cut you off, but we have some questions on YouTube and we have to come to a close. But I do want to say a couple more things. First of all, my back pain was really bad. And once I started doing this work that really fulfilled me, my lower back pain is gone, that I had for over 30 years, right? I mean, I also do physical things, and I do myofascial release, and I do strength training and yoga, and, I do all those things. But that alone didn't make a difference. And one more thing that I notice a lot of times, that we identify, like, I've had this pain for so long, it's kind of part of my personality. It's almost like, you meet people and they tell you immediately, this is all this stuff. It's almost like so attached. So letting that go. But there's a couple of questions on YouTube, and before we end, I would love for you to answer them. First of all,
of course.
Brenda was saying, this is such a powerful teaching. I'm learning so much great information. So compliment.
Good.
And then Robert was saying, you mentioned things that you eat. Could you share a little bit more about that? We're really short on time. We're basically at time. Just really quickly, any things that you find with food that are helpful, that you found helpful? You talked about hydration a lot, but anything else that you feel is super important for people to know?
Yeah, so really, in a nutshell, whole foods, because when you have any kind of pain condition that's chronic, any kind of chronic issue that's going to put your state in sympathetic dominance, that's an inflammatory state. So you want to be able to tame inflammation. We do that with manual work by improving lymphatic flow, but you can do that with diet and foods by having high omega fats, things that are anti-inflammatory in nature. So nothing processed, low sugar, low salt, good protein levels. Because when you're thinking about rest and recovery, think about all your hormones, all your neurotransmitters. These are to regulate your nervous system. You need a good amount of protein to be able to renew and recycle those peptides. So, they say you should have at least 1 pound, 1 gram of protein per pound of body weight. So most women, I'd say, are under proteined. So, you think think you have enough, but you need way more than you think. These are all going to impact your eyes too, because your eyes are sitting in a viscous fluid that is mix of protein as well as fat, and then obviously hydration too. So we need foods that have really good mineral sources that help you pull water into the cell. So a lot of toxins have an affinity for eyes, right? They have an affinity for liver, kidneys, and eyes. And there's a connection between your liver and your eyes, and your kidneys and your eyes through diabetes and jaundice. Those are the two most glaringly obvious eye connections that I can think of. So if you have a balanced blood sugar and you have more fibrous foods that are plant-based, but also have good levels of protein. So again, whole foods, and you're not in a state of low blood sugar or too high blood sugar, that's going to be really effective for taming inflammation. Then the other side is making sure you're having good liver healthy foods. So vitamin C, things with that produce glutathione, or you can take that as well. Milk thistle, artichoke, prebiotic foods that are going to feed your good gut bacteria. And all of these things are connected, your liver, gut, brain axis as well. So there should be an eye axis there, because remember, your eyes are an outpouching of your brain. So whatever you're giving to your brain and gut is going to impact your eye health, especially vitamins A, D, E, and K.
Thank you so much. I mean, absolutely. I have an eye doctor friend, she's holistic, and she always says the eyes are not just a window to the soul, they're a window to the health. And one more comment before we go into the Zoom meeting with just my Clear Vision Club members. So Lauren is saying, I will have to watch again. I was inspired by glasses without prisms, and my eyes are correcting the convergence deficit. So I actually do work a lot with that. There is also some certain exercise that are helpful. But yes, I think, we all agree here that, and maybe Deidre, you're the same way. Sometimes we need allopathic treatments. Like sometimes if something, I never say you never need to do that, but it's really more helpful to address convergence insufficiency or all those things with probably some vision therapy exercise, but also with the body work and with the emotional release and all these. It's all these factors coming together, right? It's not like one thing, one quick pill that we can swallow that will solve all these problems. By really, and it's work, right? Sometimes, I don't know about you, when I think when people come in severe pain to you, the severe pain is more like we address that because it's urgent. It's so, painful. But when it comes to the more chronic things that we almost, like you said in the beginning, that we're almost gotten used to, it's more challenging sometimes for us to take action, but it's really important. Don't wait till it gets really bad. That's what I always say. What are your last words? And also, where can people find you before we close off? Where can people find you? Because you're based in London, right? So
yes, I'm based in London, but I can do virtual sessions. I'm on Instagram at the Functional Osteopath. At the moment, that's my only social media platform, but I'm getting there. I'm working on all of these things. It's probably best to connect with me there. But I would say too that, we can't say that one thing is better than the other and you can't use one or the other. It's just that we work in harmony with allopathic medicine. It's not something that, it has its role and it has its place, but exhaust all the holistic avenues first before jumping into, and I would say that for the same thing about someone who wants to get a disc surgery, because I treat backs. So you have back pain, don't jump to going and getting a, surgery for your back. There could be other options. And I will also say that with chronic pain treatment in general, visualization is one of the biggest tools that I use for people who can't move. So you can actually, and this is back to the neuroplasticity point of learning and memory, you can train your brain to out of pain through the use of visual tools with visualizing thinking about remember I said that most of your brain is going to visual processing of information. So you need to encourage that with things that inspire and evoke joy and bring out positive feelings in your body. I know that doesn't seem like it's effective, but it is very effective.
It is. I think 80% of my work, or 90%, is definitely related to that. Thank you so much. We have to come. Thank you everybody watching on YouTube. And if you watch the replay, follow Deidre on Instagram, the Functional Osteopath, and that you subscribe and like this channel. Click the little bell. We have great show every Wednesday. Thank you so much. That was amazing. And I learned so much from you. And I also excited how much overlap and how much our work actually fits together so perfectly. So I'm
me too. I'm so glad to have found you for myself, selfishly.
Yeah.
But also I keep recommending you to my friends and clients.
Thank you. And that's the beauty of social media, because a lot of times we hear so much negative stuff. And I think a lot of the connections, with you, I wouldn't have made without Instagram and without, connecting on the internet.
Exactly.
It's like, it's definitely, it can be a bad thing, but it's also a really good thing in terms of connecting. So thank you so much, and goodbye, YouTube.